It's 1:45 in the morning. I've just got an urgent phone call from the hospital. Our intubated and ventilated patient, the ventilator's gone off without any warning. One of our nurses is bagging the patient at the moment, and I've just put our biomedical engineer into a car to rush down and hopefully sort the situation out. So I'm just going to phone and see how things are getting on, and we'll keep you posted. Hello, Joel. Has he got here? Has he got there?
Yeah, he's here. Yeah, he's here.
That's good. Okay, and is he just trying to sort it out? Is he?
He's trying to, yeah.
That's good. Hopefully, it'll be that. It'll be the portable oxygen, I suppose. And the.
Yeah.
Yeah, great. And the patient's all right.
Patient's all right. Yeah.
Great. Okay, good. Well, I'm sure we'll let him get on. Hopefully, he'll sort it out, and he'll have a bit more of a calmer night. Okay, give us a ring if you need us.
I will, yeah.
Okay.
Okay.
Bye.
Sure.
Bye.
Bye.
Hello and welcome to day 4 of the mission. It's 5:30 in the morning, and I'm just going to check in and see how they're getting on in the hospital after the rather urgent flurry of calls we had in the middle of the night.
Hello. Hi, sir.
Hello, just checking in. How's everything? How's the patient? How are you?
It's been all right. We were able to extubate him around 2:30 in the morning.
Yeah, great.
And since then he's been fairly stable.
And did anyone kind of work out what went wrong with the ventilator, or was it the bottle, or was it? Do you know what it was?
Yeah, we didn't see any kind of problem with the oxygen cylinder, so probably the battery or something went off. And he said he will come and try and fix things, but he's already got another ventilator which is fixed.
Okay, great. So good for today.
Yeah, good for today. Yeah. But the only thing is we need to be aware of the fact that we only have one connector from the oxygen cylinder to the ventilator, so we can't have 2 patients on ventilators at the same time. That's all.
Okay, all right. That's pretty important if we're going to try and do 2 cases today then.
Exactly, yeah. So this is a problem apparently, because he was saying we might not get any sort of notification of that. So suddenly the oxygen supply goes off, and then we have to get these big cylinders. So that's one thing that he was mentioning, and apparently one of the patients died in the mission because they couldn't get the oxygen in time.
Blimey. So here we are with Fiona and Ali. Last night didn't go quite as well as the first night, did it? Tell us what happened.
The ventilator stopped. Had to get the oxygen. There was nothing else we could do. We had to bag the patient. While I bagged the patient, Fiona got a new ventilator that we'd never ever used before.
Yeah, and then because there's only oxygen and it's a low supply of oxygen, when we eventually got the ventilator to working, because it kept alarming, flow sensors, oxygen sensors, blah blah blah. We were concerned, although we had the ventilator working and it was ventilated, well saturated, stable, it was alarming 100% oxygen because there was no air, and it's supposed to have an air, and that was the bit we didn't realise. So then
slowly alarming.
It was just alarming 100%, delivering 100% oxygen, and we had it set at 30. But it's because they didn't need to put a compressor on, which we didn't know about, so that's what Amos came in, put the compressor on, then the oxygen came down to 30.
Too low in the oxygen tank. Stopped it, alarmed and turned off?
No, it didn't alarm at all, it just stopped. I was just stood next to it. Just stopped completely.
And alarms didn't even go off?
No.
And you were just standing and so you had to grab a bag and...
I said other things, but grab a bag was one of them.
So talking about, given what happened last night, whether doing 2 cases is not a great idea, and we should probably do the less good one first. So we should probably do that guy first, so he can then be managed in the afternoon and evening by us.
So we need to go and talk to Amos. I'm happy to try and do 2, because I think, a bit like Joel, we just need to know whether it's possible or not, because for the future, if we know that we're coming, we're only ever doing 1 case a day, that helps in our planning and our thinking. Good one. Yeah.
I think this is a point we should highlight for new groups, the team composition, and how something like a biomedical engineer that people wouldn't think of is important.
Go on then.
It wasn't on my list of things to think about.
Do you think we had a UK biomedical engineer here? Do you think they could have managed?
No.
I think they would have rocked in the corner. I think that's pretty much what they would have done. I think no.
Well, welcome to day 4. We've learned some lessons here in the last few days about how to compose an ideal team for humanitarian missions, and one of the key individuals that newer groups may not consider is a biomedical engineer. They're absolutely invaluable. We had an issue with a ventilator turning off last night in the middle of the night that none of us could have managed other than the biomedical engineer with all of his expertise. The other important thing to think through is your nursing staff. I mean, we would like ideally to have 24/7 kind of skill transfer and teaching at the bedside and also care management, and so sometimes 2 nurses, it can get quite labor intensive for them over a period of time.
And how many of every specialty do you think we should bring?
Yeah, I think that it's ideal to have 2 of each key person, so I think it's ideal to have 2 surgeons, not just in case one has GI distress or another problem, but also to be able to discuss the surgical judgment and management and just get different input. I think it's probably ideal to have 2 anesthetists. I think that's really helpful for the same reasons. Also, the perfusionist, I think, would appreciate perhaps another person as a backup. It's nice to have 2 of those key players, and then perhaps a larger number of nursing staff to be able to circulate.
Would you recommend scrub nurses and
please,
ODPs?
yes, thank you for pointing that out. So a scrub nurse, and I think probably 1 scrub nurse.
And I think one thing we maybe didn't discuss or think about enough was the overnight management. There's emergency reopenings, or even simple things like syringe drivers. I mean, what do you think the ideal overnight team really is?
Yeah, well, I think it's ideally 1 or 2 of our team nurses, along with someone like a surgeon or a trainee or someone who can recognize a problem and knows when to ask for help.
Hello. The team has arrived after all your excitement.
Oh, yeah.
You get it wrong.
We'll tell them.
We need human resources.
Yeah.
Put up, I mean space. And you've been wasting time on that. And when I say they don't get it, and who say different things.
No, yeah.
They don't get it.
Okay, yeah, no. Well, because I think you're right. People don't understand what it takes to get a patient safely through a cardiac operation, and how quickly things can go wrong, and how patients can just die. This guy would have just died.
Absolutely.
Just like
and
that.
your name, and this is
Attended to the patient.
Yeah.
All we saw that the ventilator. Yeah, it just stopped.
Okay.
There was no blink. It just went off.
Okay.
But the oxygen cylinder was, almost full.
Okay. Fine. So that's completely different from what I was. So there's a problem with the actual ventilator.
Yes, not
Fine.
the oxygen.
and he is used to that. It has happened before, so
Okay.
Why does it keep happening? What is...
They are not able to tell us what the problem is. They usually just fix it, test it.
So
Other problem in our case, like we only have 1 regulator physically at the moment.
Okay.
So 2 patients can't be ventilated at one time because we need 2 regulators to connect the oxygen cylinders to. But Amos said he's gonna find a few regulators, so that means we need to have at least 3 oxygen cylinders full with us inside here, because when the cylinder goes off, it doesn't give us too much time. So we should be able to carry it from somewhere, fill the patient in, and it's going to be a bit of a problem.
So that at least we understand the problem, which is the problem with the ventilator, not from the oxygen. I kind of agree with you then that actually we should just plan to do 1 case, because actually to do 2 cases, we run the risk of having 2 patients ventilated and needing 2 standby ventilators. That's the only safe way to do 2 cases today.
Tell us about an update about Elizabeth.
Well, the Elizabeth story became slightly complicated in that, having postponed her operation because she had a low platelet count, or potentially cancelled it, a second blood test showed the platelet count was in fact normal. And sometimes labs do give results in error, so it is worth rechecking these kind of strange abnormalities. So she would actually be a candidate for surgery. In order to do some work yesterday, we had to go proceed and operate on a different patient who's doing very well. And we also have a patient today, so Elizabeth, I'm afraid, won't be getting her operation this time, but assuming we find the money and resources to return in the reasonably near future, we would hope we would operate on her at that point. She's stable, she's not someone who's going to come to harm in the short term, or obviously she doesn't need surgery to obtain a good outcome, good life expectancy. So I hope that's what happens, but it hasn't quite worked out this time.
Slightly better news for her.
Well, yes, I hope so. I think it just opens up to me how much the African system is chaotic through no one's fault. It's just the resources and the ability to do things is so limited. They're so resource limited, and the local guys are so good at trying to work around those limitations. But clearly, you can't succeed all the time. So yeah, I'm very impressed by what I've seen from the people who work within what is an incredibly resource limited system, and quite humble actually.
I think we've learnt a lot on this mission, haven't we? And we've certainly learned that you two are absolutely vital. So,
And how much we appreciate our marvellous team at James Cook. Missing them all.
Great, well done you two, and sincerely best of luck tonight.
Thank you. Thank you for answering the phone.